My presentation is on the article, Healthcare in America, the Values and Experiences that Could Shape Healthcare Reform. Healthcare is a top issue for many Americans. Many have gained coverage through the Affordable Care Act. Many remain uneasy about ability to get healthcare they need. In an American political system resistant to change, reform is a monumental challenge. Deeply held values regarding healthcare often guide our policy preferences. How Americans respond to reform depends on whether they think it is right and how they feel access should prevail. There are many questions, such as expand or limit choices, role of government and private business, cost people should bear when healthy or sick. A survey was conducted by Commonwealth Fund, Harvard Chan School of Public Health, and the New York Times. 93% of people believe it is important that all Americans are treated equally in terms of health care they receive. 16% believe all Americans are currently being treated equally. Day-to-day experiences fall short of these values. Half of Americans are dissatisfied with cost of their care, and a quarter of Americans are somewhat dissatisfied with their ability to get the care they need. How can we design a healthcare system that aligns with our values? 80% of people have a favorable view of Medicare. 61% surveyed believe government regulation is indicated. 53% would be willing to pay additional taxes for healthcare. But how much? Nothing is free, and this would be an expensive proposition. The public sees government intervention as a double-edged sword. 68% of respondents had favorable views of employer-sponsored insurance. How do we resolve? There is dissonance between the system failing to provide service to all and guarantees all have the right to health insurance regardless of ability to pay. It appears Americans would like to see reforms beyond what the Affordable Care Act put in place. Medicare and Medicaid are government programs in place for elderly, disabled, and those living below the poverty line. What is the path forward? Healthcare reform is a politically contentious issue. Clinton presented an overhaul that floundered, but the Affordable Care Act is larger in scope than any earlier reform. And with all its need for improvements, it has many gaps that remain. Closing gaps between values and producing meaningful improvement is what's needed. Personally, I don't think Medicare for all is the answer. This would cause a tremendous increase in taxes for all. Unemployment would grow another 1.5 million people from the healthcare industry. The best and the brightest would not be attracted to healthcare, and these are physicians and providers we all need. I believe in improvements and in expansion of the Affordable Care Act. Healthcare is expensive in the United States, and redundancy, quality, and preventive health need to be at the forefront.